Deputy Speaker, and I congratulate the Honourable Member for Hempstead for securing this debate. And I apologise at the very top if I stumble between illnesses, diseases and genomics. This is not my specialist subject. These rare illnesses are collectively widespread. There are thousands of different rare diseases and illnesses, and each one can require highly specialised treatment. This means that people living with the illnesses and the diseases can face the prospect of a long diagnostic odyssey before they are accurately diagnosed and able to access treatment. The various aspects of their treatment and care also often lack coordination. It is vital that we continue to strive for improvement and ensure that all those living with a rare disease get the right diagnosis faster, can access coordinated care and specialist treatment. The UK Rare Disease Framework was co-produced by the UK Government and devolved nations. The framework sets out the key priorities for the next 5 years in improving the lives of people living with rare diseases, and each nation committed to producing their own action plan based on how these key priorities will be implemented. The Scottish Government understands the importance of the framework and are committed to implementing the 51 commitments outlined within it. They also welcome the progress that has been made in Scotland in delivering genomic medicine and empowering patients through the UK Rare Disease Forum. In December 2022, the Scottish Government published the Rare Disease Action Plan. This action plan was developed through significant engagement with the rare disease community. Through the combined efforts, the Scottish Government will ensure that they are putting those lives with a rare disease at the heart of policy making, ensuring this meets the needs of the rare disease community in Scotland whilst reaping the benefits of a four-nation approach. The Scottish Government's action plan sets out 4 key themes in order to implement the UK Rare Disease Framework: ensuring patients get the right diagnosis faster, increasing awareness of the rare disease and among healthcare professionals, better coordination of care, and improving access to specialist care, treatment and drugs. The Scottish Government remains fully committed to ensuring that there is continual improvement in supplying patient-centric care that is safe and effective for those living with any rare disease. The genomic medicine landscape is developing rapidly. In the last 5 years, we have seen the implementation of impactful genetic testing for a variety of conditions, which has helped inform patient treatment, allowing patients to receive the right treatment at the right time. Pathogen genomics is also helping to deliver precision public health by guiding investigations of infections, outbreaks, antimicrobial stewardship, better targeted disease control and infection surveillance. The Scottish Government published Genomics in Scotland, Building Our Future in March of this year. The Scottish Government's strategic intent is to deliver an equitable, person-centred, population-based genomics service and infrastructure for Scotland. This publication is the first in a series setting out the Scottish Government's strategic vision for Scotland's genomics future. The Scottish Government will publish a series of documents in the future, setting out how they will deliver genetic services which will not only allow Scotland to treat disease, but prevent ill health before the prevalence of symptoms. Scottish physicians and scientists have been actively participating in the advancement of genomic medicines over the past 3 decades. Scotland is a great foundation to build upon within the NHS laboratory network, but it's important that these laboratories are fit for the future, as we know genomic medicine is on a steep trajectory. In order to achieve the Scottish Government's ambition of having a genomics ecosystem with the infrastructure to support it, it will require investment in rapidly evolving technologies, skills and facilities. The Scottish Government will be innovative and adaptive to change, working collaboratively through the triple helix approach with academia, industry and the public sector to harness the opportunities at their disposal and deliver an integrated approach to genomics across Scotland. The genomics strategy aligns with the Rare Disease Action Plan and will engage with the Rare Disease Implementation Board as well as key rare disease organisations like Genetic Alliance UK to ensure the strategy is informed by those who will benefit most. While I see the intent and acknowledge the money being spent, it's clear that far more money is required to fund the research that is needed. And this government's overspend tens of billions of pounds on MOD, on cross-sale, on HS2, and, ironically, PPE during a health crisis, shows me the one thing: the money is there if we can access it and spend it wisely. In Scotland, following the 2022-23 emergency budget review, genomics was allocated a revised budget of £5 million. Through the funding allocated so far in 22-23, the Scottish Government have established a Scottish Strategic Network for Genomic Medicine and funded a genomics transformation team with an NHS National Services Division led by consulting clinical scientists and supported by clinical leads for rare disease and cancer. Genomics medicine is an integral part of the precision medicine and precision health. It can enable earlier and more precise diagnosis, as well as more targeted prevention and management of diseases. And finally, Mr Deputy Speaker, over the next 5 years, the genomics landscape in Scotland will be transformed as we work to ensure that patients have equitable access to timely, personalised and high-quality genomic medicine for a range of conditions which include FOP.
Opposition. Karen Smith.